Alrighty, so we had finished with occipital bone, but remember at the very beginning I said that we have air spaces in some of our bones known as sinuses. And we talked about the frontal sinus, okay? And I neglected when we were talking about the temporal bone to mention the temporal sinus. So this is a portion of the temporal bone that you see here, and this is the temporal bone on this model. Here's the squamous region. Remember, that's the thin lateral wall of the cranial cavity, and the petrous region is the thick floor, portion of the floor. Here is the mastoid process, and then if we open that up, you can see small spaces or rooms, and those are the mastoid sinus. Those belong to the mastoid sinus. This is the only set of sinuses that does not drain into the nasal cavity. All the others within the face or anterior floor of the skull will drain into the nasal cavity. Okay? All right, so we did temporal bone, occipital bone, and now we are ready for the next irregular shaped bone that has weird processes, and that is the sphenoid bone. So this is the one that looks like a butterfly, or a bat, or a moth, or whatever your favorite winged reptile might be. And if you look at your skull, take off the top and look inside the skull. And this lavender area right here, it's hard to distinguish in the real bone because it's not lavender. But you can see that there are two levels. And we have a shelf here, and then we drop down to the floor of the cranial cavity. It's hard to see where the sphenoid bone changes from the temporal bone, but if you kind of follow the pattern here, you can kind of get an outline of that. And this is one view. The sphenoid bone, probably more than any other bone, looks different when you look inside the skull and underneath the skull and from the side of the skull and from the orbit where the eye socket is. So I want to show you those different views, and then we'll start talking about processes and openings. So this is looking down inside the skull, and from a real skull view, so right across here would be the most anterior border of the sphenoid bone, all right, and then right along here would be the greater wing that we're seeing, and that would join with the temporal bone right about here. Okay, right about where the carotid artery came in, because the carotid canal is part of temporal, but this opening is part of sphenoid. That's the sphenoid bone all by itself from that same view, with the frontal bone absent and the temporal bone absent. Okay, now if you turn the skull over, again, we'll come back and name these structures. So if you turn the skull over, right, find the very midline structure. So here's the roof of the mouth. Come back down, and you can pinch this bone between your thumb and forefinger. You guys find that? Now go lateral to it, and you'll find two thin plates that are flaring outward. The most outward one, most lateral one, is the largest. Those are also wings. Pterodactyl is a dinosaur with kind of a wing spread amongst its fingers. Okay, and so the P is silent. P-T-E-R-Y-G-O-I-D, pterodactyl, the pterygoid. So these are pterygoid processes or pterygoid plates. Either one is fine. And they're a site for muscle attachment. Then if we look at the side view of the skull, here's the zygomatic arch and the zygomatic bone. And running right through here is a part of the sphenoid bone. And you can see the pterygoid plate by looking through the mandible here. Okay, so again, I'm just kind of showing you it looks different for the different ways that we look at the skull. And then finally, if you look into the orbit, the sphenoid bone, again, the purple bone is forming the posterior wall of the orbit. Okay. So again, people are getting a little overwhelmed, or a lot overwhelmed, by all these bones and processes, especially in the skull. We start off with probably the hardest bone. First of all, do the general structure. Choose a bone. If you're the kind of person that, eats the okra that you hate before you eat your dessert, and choose the hardest bone. If you like to eat your dessert first, And choose the easy bone if you like to feel good about yourself first. And just find that bone in a colored picture. Look at all the different views and feel comfortable with where it is. And then focus on its parts, okay? Rather than trying to name all the bones in the skull. And then you start getting mixed up about where you are, okay? And then focus on its parts. Make the flashcards if you want to do that for those parts and named processes and openings. And then move to another bone, okay? And now I really know this bone really well. Because if you tackle all the bones at once and try to learn all of them where they are, and then you go back and focus on parts and pieces, you're going to start feeling overwhelmed and getting things mixed up. All right, so use the colored images of the skull in your textbook with photographs of real skulls or drawings, and then move to photographs until you feel, I've got this skull down, and I've got this bone down. Now I'm ready to tackle another one. Okay? All right, so now let's go back and name structures, and then we'll look at the openings. All right? So in the view where we're looking down inside the skull, turn your skull so it's facing away from you. You're looking down inside it. Find that lesser wing, that shelf that's right here. Okay? That's the posterior, so the skull, the cranial cavity is actually kind of organized into 3 levels. So the top, the frontal, middle, and bottom one. And so this is going to be the bottom one. This is still part of the top shelf. So this is the lesser wing. Now find the greater wing. So it's going to be this portion down here. It's larger. That's, of course, the reason we use the word greater wing. Okay. Now, between the 2 greater wings is a depression. If you have a small enough thumb, you could stick your thumb in there, if not maybe your finger. And that depression is right here. In the lab workout practice, you had the body, sphenoid body, which was in front, but the depression is right here. That's where the pituitary gland sits. Okay, it is protected. Has a membrane over the top of it, but it has that bony protection. And if you got small enough, you could imagine sitting your bottom in that depression and your legs going down on either side like you were sitting in a saddle. Hence, its name is Turk's saddle, or Sella turcica. Okay? And that's the depression. If we look at a sagittal view, if I have a sagittal view on here a little bit. Nope. Okay, I'll show it to you when I get to the sagittal view. Sella turcica is S-E-L-L-A. Hypophyseal is our fancy word for pituitary, or anatomical word for pituitary. So Sella turcica. All right. Now, if we turn the skull upside down and look at this view, okay, the processes that you need to identify from this view are those pterygoid plates or processes again. These 2 structures right here. So the medial pterygoid plate and the lateral. We have 2 medial and 2 lateral. These are sites of muscle attachment. You have muscles called the pterygoid muscles. And they come from the pterygoid plates to the jaw and help you move your jaw. So muscle attachment is all you need to know for them right now. All right, now let's go back to this view and identify the openings. Before I do that, I'm going to review the trigeminal nerve that we first started talking about from the front view of the skull on Tuesday, because most of the openings that we talk about are continuous passageways for the trigeminal nerve. And remember, this was cranial nerve 5, and its primary function is sensory or motor. So remember? Sensory. Okay? So the first branch of the cranial nerve is carrying sensory information from, and I'm not going to test you on those areas where it's from. It's just, I think it helps you remember it better if you can see it in its 3 parts. So it's carrying sensory information from the forehead and the eyeball. And it's going to pass through the supraorbital notch or foramen. Then the second branch is from this area. So it's going to carry sensory information from the nose, cheek, and upper jaw. So the teeth in your upper jaw as well. Anybody remember what this opening was right here, below the eye? This is supraorbital, infraorbital. And then the third branch is for the lower jaw. Okay, so inside your mouth, again, if you bite your tongue or you have a toothache or the skin over your chin. The lower jaw, and mouth. And the two openings in the mandible are the mental brain. Okay, so I'm going to refer back to that as we go through some of these openings. However, the first one is for the optic nerve, the one that you use to see with. So turn your skull so you're looking into the face, like this, all right? And let me enlarge it so we're seeing more of that orbit. It's kind of dark in there. So the lavender purple is our sphenoid bone, and just on the medial aspect of that is a round opening. Take your alternate lights on so you can see what you're doing in just a sec. Take your pipe cleaner and put it through the orbit into that small opening on the medial, near the medial wall of the eye socket. And then turn around, turn the skull around and see where it comes out into the skull. And you should see it coming out right here. Okay? So, the optic nerve, this is one of those easy ones like the hypoglossal canal, having the hypoglossal nerve. So the optic nerve is in the optic canal. And we call it a canal because it's a little bit longer, but you'll never go wrong if you say foramen. So, so this is coming from the retina of the eye and carrying sensory impulses when you see light. Understood everybody? Yes. Okay? So, optic nerve, optic canal. Alrighty? I just gave an exam on this at Sac State Monday of last week. And one of my questions on their lab exam was I had the pipe cleaner going through there. And rather than say name this opening, I said identify the structure that passes through this. Because they're practically one and the same. Okay? Optic nerve in the optic canal. All right. Now, just lateral to that, if we look at this image again, you can see a jagged, longer opening. Take your pipe cleaner and put it through that and see where it comes out. A little hard to see on here, but that's called the superior orbital fissure. Fissure because it's jagged a little bit, right? So that is where the first branch of the trigeminal nerve actually gets into into the cranial cavity, once it passes from the supraorbital notch into the orbit, then it leaves the orbit via the superior orbital fissure, and just like your pipe cleaner, it's now in the cranial cavity entering, well, your pipe cleaner is not entering the brain, but the nerve would. So the nerve is then going to go in through the superior orbital fissure. Okay? So this is what we see from on the forehead, and then it goes through the orbit into the superior orbital fissure, and now it's in the cranial cavity. The second branch of the trigeminal nerve passes through the infraorbital foramen right here. Now it's a kind of complicated pathway, so it won't come out that. It may or may not, if you put it through that. Kind of goes through the that won't work. So for this one, just do it from the sphenoid bone. And so take it from the back here like this and put it in. There's a small round, it's not tiny, but it's smaller than the optic canal, right at the base here of the superior orbital fissure. If we look at this image, it's right here. And that's called the foramen rotundum. So that one.
Oh,
Yeah.
right.
Wow, first try.
So yeah, it's going to go across a gap between the bone and the sphenoid bone and the maxillary bone. Yeah, it's going to go. Yeah, it's going to come down to the lower. Uh-huh.
A little canal there that it.
Yeah. So this is the second branch.
I think it goes through the face.
It goes through the infraorbital foramen and then it goes through the rotundum.
Right.
I'm just writing
Because it's
the
it's
go
getting
here, then go
feedback
here.
from outside going in. Cheek in.
Yeah, and it's going to come out through right there. I'm sorry, wrong one. There.
Okay.
And there. I had this here. Okay? So the second branch goes through the infraorbital foramen, across a gap, and enters into the skull via the foramen rotundum. Now, you'll notice that these openings kind of form a crescent shape, all right, that follows this greater wings here along the sphenoid, the sella turcica. So the next opening is farther back, a little bit more lateral. Notice it's oval. It's a little bit larger. This is because the nerve is larger. We actually have all the motor nerves going to your chewing muscles as well. This is for the third branch, foramen ovale. So mental foramen from the jaw, behind the jaw, up into and through the foramen ovale. Anybody have trouble finding that one? Yes.
Would it be okay to say ovale foramen or does it have to be foramen first?
Oh, I'd accept it either way. Yeah. Right there, yes. Yeah. Now right lateral, as I'm walking around at the same time here. So if we curve around even farther, you can see a tiny little hole. and that is the foramen spinosum. That is for a blood vessel. It's not carrying blood to the brain, but it's carrying blood to the dura mater, the membrane that surrounds the brain, the meninges, and so it's known as the middle meningeal artery, and that's going to pass through this foramen spinosum. When you look at that foramina, those foramina, you'll notice that, especially on the side here, there's thin grooves in the skull, like a worm was kind of eating its way, or a bug beetle under the bark. But it branches up and along, kind of you can see a little bit here, along the bone. And as this artery is there, when the bone tissue hadn't yet ossified, and then ossified being depressed by that bone, that groove there, and so along the side, you can see the groove for that blood vessel. Okay? So the foraminal valley, the large oval one, and then the tiny little hole right beside it is foramen spinosum. Okay? Now remember we talked about, there's a groove right here, that artery. So remember how thin the squamous region of the temporal bone is? Okay, you have a really tiny foramen spinosum. Look at that deep groove there. So that's foraminal valley. So that thin portion.
Because we're in Deverton.
Thin portion is easily broken. And what it is a blood vessel is torn. And that blood vessel is torn, unlike your skin, the skull can't swell out. And so what happens is the pooling of blood pushes the brain in. This is soft tissue. And that is a form of putting pressure on the brain. There was an actress, she was in the new version of Parent Trap 10, 15 years ago when Lindsay Lohan was little. She was skiing with her family in Canada and fell and went back to her hotel and ended up dying from the pressure on the brain because she had torn blood vessels and the pressure just built up. So ovale is there, spinosum is there. Okay, and so I read an incident about a young man. He was about 14 or 15, so probably in Babe Ruth baseball, and he was at baseball practice, and they were just lobbing the ball back and forth. When you warm up, you start close together, and you gradually move farther and farther apart. So it wasn't an actual game. The ball wasn't being thrown with great force, and he had turned his head for some reason, and the ball hit him in the squamous region of the temporal bone, and